Hello, I'm Zainab Badawi, and it is my pleasure to be moderating the launch event of the Sanitation and Hygiene Fund. Now, we have a number of voices from all over the world who'll be telling us what it's like to live with inadequate sanitation and hygiene, and just why the world needs this new Sanitation and Hygiene Fund, especially as we are in the grip of the COVID-19 pandemic. First, let us set the scene and provide you with some context with this introductory film. The Sanitation and Hygiene Fund offers a 21st century solution to a decades-old challenge. Many of the world's most serious diseases and main causes of child mortality are related directly to poor sanitation and hygiene. Yet, despite this, there has been considerable underinvestment in this sector for many years, and this has hampered progress on the Sustainable Development Goals. Sanitation and hygiene are key components of SDG 6, but many of the other goals are dependent on it, like ending poverty and hunger, and achieving improved nutrition, good health and well-being, quality education, and gender equality. And the current COVID-19 crisis has been a stark reminder of how sanitation and hygiene are the first line of defence against pandemics and other deadly infectious diseases such as cholera and dysentery. Also, patients' treatment and care is severely compromised when healthcare facilities lack proper sanitation. This exacerbates the spread of antimicrobial resistance and undermines efforts to improve child and maternal health. Women and girls in particular suffer huge disadvantages from inadequate sanitation and hygiene simply because of their gender. They can miss out on school and work because they lack the means to maintain their hygiene during menstruation. This can also expose them to gender-based violence, affect their sexual and reproductive health rights, and limit their social and economic power. Currently, more than 4 billion people globally do not have access to safely managed sanitation. So, the Sanitation and Hygiene Fund has been created to make a real difference to their lives. By raising and investing the necessary funding, it will bring about change and drive this transformation. The fund will finance programs that produce large-scale and measurable results and deliver a fundamental social and human right to millions who've been robbed of their dignity. So, sanitation and hygiene is not simply a matter of health. It is also a fundamental social, economic and human right. One of the strongest advocates of the Sanitation and Hygiene Fund is the Deputy Secretary General of the United Nations, Amina Mohammed. She explains why it plays a critical role in helping to achieve the Sustainable Development Goals.
Thank you, Zainab, and this is great for us to be able to address these issues, particularly on water and sanitation, close to my heart. Well, how are we doing? Before COVID, we were falling short, and now with COVID, these issues around the SDGs have been exacerbated. The GA moment on the SDGs showed that really at the heart of what we were speaking about was equality and making sure that everyone had access, everyone had a right to aspire to the goals that we have. And this has not happened, in particular with COVID showing those inequalities for women, for youth, the informal sector, and quite frankly, as we have seen in many emerging markets, that vulnerability is not just a question of the poorer countries, it's also become a big issue with our middle-income countries. We can see that the COVID pandemic has created many opportunities for us to respond now with hope of a better recovery to get back on track with the SDGs.
So, Deputy Secretary General, just spell out for us what steps are needed to move the needle on this.
I think the first step is to move the needle on trying to get, in this decade of action, to the SDGs, is an acknowledgement and implementation of a global response. This is because we're seeing that with COVID, it went beyond the health crisis to the socioeconomic impacts that we're seeing country after country. And we're now just going into the second wave where lockdowns in developed countries are having huge impacts on developing countries. So the things that we need to do is to really bring up those socioeconomic response plans that treat development as an emergency, making sure in our stimulus packages that we are investing in the opportunities of social protection, that we're looking at connectivity and where children are out of school, so that we can actually talk about a recovery that puts an emphasis on issues like water and sanitation. The joint framework that the Secretary General launched on the Sustainable Development Goal number 6, water and sanitation, has 5 accelerators. And I underscore here accelerators because that's what we need to do to get the scale and urgency behind this. Financing, which really is about optimizing financing for water and sanitation. Data and information, building trust through data generation, exchanging it for decision making, leaving no one behind. Capacity development, focus on human capacity to deliver on SDG 6. Innovation, leveraging and the scale up of innovative practices and particular technologies. And governance, making sure that SDG 6 is everyone's business through the cross-sector, transboundary collaborations, clear roles, stakeholder involvement, and last but certainly not least, effective institutions.
So looking at this in terms of the world's response to the COVID-19 pandemic, everybody's eyes are on the horizon for a number of possible vaccines, but vaccines alone are not enough in fighting the pandemic, are they? Sanitation and hygiene is absolutely critical.
Yes, I mean, sanitation and hygiene, critical to the response that we want to see. First, because it is about human dignity. Second, it is a health issue. And so in the short term, getting us into the WASH programs, ensuring that that basic hygiene of washing your hands and being able to have a toilet that is accessible is key. In the longer term, it is about the infrastructure and what we put down within the evolution of our sustainable infrastructure, cities and rural areas. We need to make sure that water and sanitation is reticulated. It is about keeping girls in school. And it is also, I would say that, you know, for sanitation and hygiene, at the core of it is the multiplier effects that it will have for all the other goals.
So here we are launching this new Sanitation and Hygiene Fund. How important do you think it will be in helping to combat coronavirus and also future outbreaks of similar diseases?
Right now, the opportunity is to stop the pandemic. And so any fund that provides the capacity, the technical expertise to help countries better inform the plans, and for it to be an integral part of a stimulus package, of a plan that governments would have for water and sanitation is important. So I think the leveraging power of this fund would be really important for the scale at which investments need to be made to reach everyone, just leaving no one behind. This is a very exciting opportunity. Water and sanitation is at the heart of what we need to do for including our women, our girls, and ensuring that the Sustainable Development Goals become a reality in everyone's lives. The fund today, launching that, gives us yet another opportunity to make sure that we include all the investments that are necessary for water and sanitation to become a reality, a right that is delivered in all people's lives.
Amina Mohammed, the United Nations Deputy Secretary General, on why she has been pushing for this new Sanitation and Hygiene Fund. Amina Mohammed's home country is Nigeria, which is of course Africa's most populous nation with more than 200 million people. In 2018, the government declared a state of emergency for sanitation and followed this up with a national campaign to end open defecation. Its Vice President, Yemi Osinbajo, tells us why the government is making this a top priority.
Water, sanitation and hygiene, as you probably would appreciate, are the preeminent public health concerns. And of course, they are critical to tackling the spread of deadly infectious diseases, especially cholera, the whole range of diarrheal diseases, Ebola, polio, and practically all of the maternal death-related ailments, and also in reducing neonatal deaths. In fact, almost a huge percentage, I must say, of under 5 mortalities are due to compromised hygiene and sanitation. So this is absolutely crucial. There is no way of addressing the major public health concerns we have without dealing with the questions around water, sanitation, and hygiene. We have worked very hard to ensure that we're able to address the questions around females, especially menstrual health issues and all that. These are concerns that we have, and in all of the various initiatives, central to this are the concerns that females have in particular.
Mr. Vice President, over the past couple of decades, Nigeria has made very good progress on health, in particular in immunization. But progress on sanitation and hygiene seems to lag far behind. Why do you think progress in this sector is so difficult?
It's a complex problem because it's closely tied, especially in developing countries, to poverty, to living conditions, infrastructural problems. And effective public education is also a challenge, which is why we launched the Clean Nigeria campaign, aiming to make Nigeria open defecation free by 2025. The slogan is Clean Nigeria, Use the Toilet. And it combines investment in infrastructure facilities with changing people's habits and attitudes through information and by example as well. Again, it's complex. And so I think that what we've tried to do is as much as possible to ensure that the language is simple, is accessible, and that even the slogans are also simple and accessible and easy for people to relate to and understand. So that's it. It really is. It's not as you can imagine. Making people change their habits is even for their own good is probably one of the hardest things to do.
How important is it that you get buy-up on this campaign right across all government departments?
Absolutely important. As a matter of fact, our campaign is one that is all of government. We have an all of government approach, and I have the privilege of chairing the committee.
So as you've been outlining, it's very much the responsibility of governments to take the lead in achieving better sanitation and hygiene. But what role do you think this new fund could play in helping you meet your goals and other countries like Nigeria?
As we found with the eradication of polio, it's clear that action follows money. And it's also important that funding is tied to measurable performance. So for us, I think funding is critical. And this fund in particular is of great importance. It will cost us $2.5 billion to end open defecation in Nigeria by 2025. 25% of that is to be provided by governments, that's the federal government and state governments, and 75% will be provided by households, in the various little efforts that they put into the entire campaign.
So do you welcome the creation of this new fund?
We think that the fund is, in many senses, a lifesaver. And so we're very keen to support it and very keen to access it. And I think one of the features that I particularly like is the fact that it is tied to performance, it's tied to measurable performance, so that it's not just, aid at large. It's the sort of aid that spurs performance and spurs achievement. So we're very excited about it, and we're looking forward to accessing it.
So the Vice President of Nigeria, Yemi Osinbajo, there clearly demonstrating the government's support for this new fund. So let's tell you a bit more about the new Sanitation and Hygiene Fund. Well, it's based in Geneva, Switzerland, and its executive director is Dominic O'Neill. Now, he's had extensive experience working in the development field across continents and has great expertise in fund management and innovative finance.
Over the last 25 years, I've lived and worked in places where vulnerable people and children are dying from diseases that are entirely preventable. I've also seen firsthand the solutions to these challenges. They are often as simple as a bar of soap, a well-managed latrine, or a basic hand-washing point. Today, everybody knows that in the face of a deadly disease, washing hands is people's main line of defense. We see it again with the COVID pandemic. In many places, masks are too expensive or too hard to find, and social distancing is impossible. So proper hand washing is the only protection that people have left against the disease. Given we know that the proper sanitation and hygiene are the best protection for dozens of diseases, isn't it truly shocking that progress in this area has been so painfully slow, and that we are so far behind in the globally agreed targets within the Sustainable Development Goals? The lack of progress in sanitation and hygiene is now seriously holding back progress on other SDG targets such as education, gender equality, and economic growth. We believe the main reason we are not succeeding is a woeful lack of investment. We need investments now in sanitation and hygiene on a large scale so that they can have a widespread and lasting impact. We must encourage people to engage and invest more in their own communities to make the changes stick in the long term. We know that money, well utilised, has the ability to drive positive and lasting change. That is why we are creating this new fund, the Sanitation and Hygiene Fund. The Sanitation and Hygiene Fund is based on proven models that work. We will focus on sustainability, climate resilient solutions, and raise large amounts of money. Then we will invest it in things that we know work and which we know countries need. The Sanitation and Hygiene Fund will be performance-led and will ensure that real results are achieved. It will be lean, efficient, and accountable to donors and to recipient countries, and will invest in the communities left furthest behind in the neediest countries. The fund will help all of our partners in the wash sector succeed. By bringing funding to the sector, we are helping shared dreams to be realised. The fund will also accelerate UN efforts by enabling countries to do their share of the work and to make use of the assistance and expertise that the UN family brings. To succeed, the Sanitation and Hygiene Fund will need to raise $2 billion for the coming 5 years. It'll be a challenge, but one we are prepared to take on. This is not only a struggle to improve health. It is a fight for respect and basic human rights and an end to stigma. It's a fight to allow people to take care of their basic bodily needs in safety and in dignity. Safe menstrual health will help girls to finish school and women to work. It will protect them from harassment, rape, and sexual exploitation, and provide them with secure, safe choices. It is a fight to grant every human being the respect he and she, they deserve. It is a fight I'm proud to take a lead on. United, we can succeed. Thank you.
Well, as we've been hearing, good sanitation and hygiene is critical in reducing child mortality. And so the fund will work closely with UNICEF, the United Nations lead agency on children. Its executive director, Henrietta Fore, says the COVID-19 pandemic has exposed vulnerabilities in sanitation and hygiene systems.
We have 4.2 billion people in the world who do not have access to sanitation services, and we have over 3 billion who do not have access to hand washing and soap. And with that, you realize that it's very difficult to overcome pandemics like a COVID if you do not have sanitation, water, hygiene services, and information. And Zainab, one of the other things that comes immediately to mind is it's not just people in their households that are having problems, it's schools, it's hospitals, it's community health clinics, and it's most difficult in the poorest countries and in the poorest communities within those countries.
Henrietta Fore, you've described sanitation and hygiene as great equalisers for children. What exactly do you mean by that?
Well, every society, every country is unequal. But when you look at something like sanitation, you realize that there is an inequality that most of us have not experienced and is extremely difficult, challenging for those who are in it. So, for instance, during the lockdown, how do you cope with the fact if your household does not have a toilet? This is particularly difficult for girls and women. Sanitation, hygiene, water. If we focus on it as a world, we could recover and we could allow this to be a great equalizer. If everyone had access to it in households, in their schools, in their health facilities and communities, it would make an enormous difference in our world.
We know what the problems are, we know what needs to be done, and of course there has been progress, but it's been too slow. So just give us one or two examples of what are game changers that would really accelerate access to sanitation and hygiene.
So Zainab, you're right, we're moving too slowly. We need accelerators. And the Secretary General came out with a framework that we think could work. So it begins with governance, political will. Good sanitation has to be a public good. Governments have to own the fact that sanitation is their problem to solve and that they have ways to solve it. So number one is that political leadership. There's just nothing that takes over that. The second is financing. Many governments find it difficult to find room in their budgets for sanitation, for water, for hygiene services, but they just must make that role. And what's good about today's world is we have ways to blend public and private finance. And when we do so, it means they can leverage and build upon each other. And the third area, Zainab, is innovations. This sector is one that people are now starting to turn to about how they can innovate, how they can do things differently. Toilets that do not need sewage systems, ways that you can have mobile hand washing stations, water filters, ways that you can make soap very inexpensively. But all of this is important that we put our thought and mind and attention to, because sanitation, water, hygiene, it is a basic human need and a right.
And obviously, Henrietta Fore, your agency, UNICEF, is the lead one at the United Nations on Children. So what is UNICEF doing specifically to address these problems?
Well, one of the areas that we've been working very hard on is to get information out to people all over the world. So we've reached out more than 120 countries to just get information out about hygiene and how important it is for you, your family, the children in your family. And then we also have been training many healthcare workers. These frontline workers become the basics that any government or community uses to be able to keep a safe and clean environment. We've trained more than 3 million of them. We've gotten a chance of putting out personal protective equipment that allows for hygiene within it and the supplies that go with it. So whether it's water, antiseptic, soaps, it's for hospitals, it's for schools, it's for households. And it changes the world that children live in. And so these will all be new innovations for our world, and it will allow us to see more clearly where we need to focus for water and sanitation.
Henrietta Fore of UNICEF. And of course, the WHO, the World Health Organization, is vital to international efforts in improving global health. And it believes that the new Sanitation and Hygiene Fund will be a significant catalyst in achieving this.
Let me get right to the point. Over 2.1 billion people lack even basic sanitation facilities. Twice that number lack safe sanitation services that properly collect and treat waste. This means that more than 4 billion people, about half of the world's population, are at risk of diseases like cholera, intestinal worms, and malnutrition. In fact, poor sanitation impacts the safe delivery of healthcare across the board, including for antimicrobial resistance, one of our biggest global health threats. Let me be clear. These disastrous health effects are preventable. This is a problem that can be solved. While the challenge is significant, the road to improving sanitation is well trod. The fundamental science has been known for decades, and the benefits are clear. Countries that have invested in sanitation for all as a public good have transformed public health, the environment, and their economies. What's more, data shows investment in WASH is cost-effective. The economic benefits of sanitation are about 5 times the cost. But all too often, what is missing is leadership. The world is alarmingly off track to deliver on our commitments to Sustainable Development Goal 6 for sanitation. Estimates project that the annual cost to achieve universal sanitation by 2030 would be $105 billion. Current investment from governments is less than 10% of what is needed. Yes, achieving universal access to WASH may seem expensive, but the cost of inaction is far greater. Lack of sanitation results in greater recurrent and preventable healthcare costs, lost income and educational opportunities, loss of productivity, and environmental pollution. What is needed is bold action, and there is no time to waste. WHO welcomes the new Sanitation and Hygiene Fund as an important mechanism to increase and catalyze national investment. The State of Sanitation report by WHO and UNICEF sets out a path for investment in governance, financing, capacity development, data, and innovation. WHO is committed to working in solidarity with governments under the SDG 6 Global Acceleration Framework and with other UN agencies and partners like the Sanitation and Hygiene Fund to urgently accelerate action on sanitation. I am confident that with strong public health investment and leadership, together we can make sanitation for all a reality. WHO is calling on all partners and member states to significantly increase investment in sanitation. The benefits across the health sector, economy, and society are well documented. WHO is calling on the health sector to play its part, especially by ensuring sanitation in healthcare facilities and at the community level by using health data and expertise to ensure sanitation investments are targeted and implemented correctly. This is critical because ultimately it will reduce the cost and burden on the health sector. But let us remember, sanitation, along with clean water and hygiene, are not a one-time investment. We must not repeat the mistakes of the past. Like health systems, doing it right requires sustained funding and careful management. So make no mistake, sanitation is an ongoing commitment. It is a commitment to a better world for all. And most importantly, with strong leadership, accountability, and sustainable funding, it is an achievable one. Together, we can build a better world.
Leadership from key international agencies and governments is important in achieving better sanitation and hygiene, but the work on the ground is carried out within communities. And I've been talking to two women who are at the forefront of such efforts. Abimira Adi is a gender rights and sanitation advocate in Calabar, the capital of Cross River State in southern Nigeria, and Petronilla Musonia, who's a program officer at Kenya Water for Health organization. Petronilla, you've been working with people with disabilities to get better access to sanitation and hygiene. Just give us an idea of the kind of challenges that they face on a daily basis.
Yeah, the people with disabilities in Kenya face several challenges. One of the challenges is they fear contracting diseases. They are at risk of using dirty toilets because of their nature of disability. They are not able to use the toilets. They have to sit on the toilet, so it makes them use dirty toilets. The second one is they lack resources to construct the toilets that are suitable for them, especially the design that is suitable, that has maybe the handles to hold, support themselves, or maybe a place to sit on properly that can help them relieve themselves properly. Then the other thing is fear of using the toilets. I'll cite an example in the formal settlement, like where I am currently. The toilets are communal, shared. So you find that reaching the toilets, especially at night, is a big challenge for them.
Abimira, we know that Nigeria is in a deep state of crisis when it comes to sanitation and hygiene. And so this is something that you are having to deal with day to day, isn't it?
Typical daily life of the persons I work with, which are mainly women and girls, would include leaving their houses every day and going to their workplaces. Those workplaces are either business places where they sell, in schools, in bus parks, in markets, and all of these places do not have access to sanitation and hygiene facilities. There are no toilets in these places. So women and girls struggle with being totally carried along in these places, especially during their periods. And then there are schools as well, where you have menstruating girls in school, and then they have to stay away for days because they do not have access to manage, to facilities that can help them manage their menstruation properly when they are on their periods. So this means that a certain number of girls will be away from school for days. So that's if there are 3 months in a term. So they are going to be away for like one week of each month because of their periods, because they do not have access to these basic hygiene and sanitation facilities, which they need to keep them in school. And again, there are the girls who live on the streets. I mean, like in Cross River State, Nigeria, where I live, you have the Colombo girls. That's the girls growing up on the streets, and they have made camps for themselves in dorm sites. So these persons live in these places without any access to proper sanitation and hygiene facilities. They procreate in these places, and babies are raised in these dorm stands. So this is the life of the average Nigerian person, or the average girls and women that I work with on a daily, from their schools to the marketplaces where they have to work. There are no access to these things, and they, of course, in the long run, it leads to a lot of health challenges, low self-esteem, and they cannot compete favorably with their male counterparts.
How important is improving sanitation and hygiene to achieving gender equality?
With these challenges, they cannot compete favorably with their male counterparts. Imagine the number of hours that you have to be away just to seek proper sanitation and hygiene facilities. I mean, girls have to be away from school during their periods, or have to leave school to go home to access toilets, because in most of the schools, there are no toilets.
You've been helping women and girls to manage their menstruation, of course, before and now during the pandemic. What has to change to help them meet their menstrual needs better?
First of all, I'll start with the current COVID-19 experience. Initially, in Kenya, the schools have been distributing sanitary towels to girls in school, but it has come to a challenge that while they are at home because of COVID-19, they are unable to get those sanitary towels for them. So we have been distributing the towels to them at home using the groups that we have formed within the community. And to make this a success, I think we should have improved sanitation latrines for girls and women to be able to change comfortably and use freely within the communities and school setups. And also the mindset in that in Kenya, there are so many taboos in regarding menstrual hygiene management. So if we change the mindset of these communities, we'll be able to support the women and girls. After changing the mindset, everybody will understand the importance of menstruation and hygiene, that it's not a women's only issue, it's everyone's issue. It will help the entire community understand the women issues regarding menstrual hygiene management.
So what kind of assistance would you like from the Sanitation and Hygiene Fund?
I believe I'm a linkage between Sanitation and the Hygiene Fund and other organizations that I support, and therefore it's my duty to support the communities we are working with. So the linkage between the community and their donors is my responsibility.
Two activists, Petronilla Musonia and Abimira Addy, in the vanguard of efforts to bring better sanitation and hygiene in Kenya and Nigeria. The new Sanitation and Hygiene Fund aims to boost the work of such communities, but it needs massive amounts of money to do so. The fund is hosted by UNOPS, that's the United Nations Office for Project Services, and its executive director, Greta Faremo, explains how they're trying to attract potential investors. First, I ask her why she believes that sanitation and hygiene just does not attract sufficient global attention.
I've asked myself that question so many times, because I think we all see that clean water and sanitation is at the core of development to any community, family, or individual. Maybe it's because we take it a bit too much for granted. And also maybe it is because we don't really focus on funding and mechanisms to bring the attention to this particular area. When we look at education, you and I see many times girls drop out. And we wonder why. Well, actually, UNOPS in its infrastructure work very often see that schooling comes down to proper sanitation facilities. And when we talk about medical facilities, if there is not access to clean water, well, those facilities would not work. And polluted water, we also bring bad health. So we're reminded in so many of our projects how important clean water and sanitation is. And we want to gender mainstream our infrastructure projects. And looking into the role women and girls play in fetching water. It's also key when we talk about gender mainstreaming to understand how we, through bringing clean water and sanitation, also can actually help gender equality in a big way.
The model, the approach of UNOPS is very much one that's based on implementation. So just give us an idea of how this new Sanitation and Hygiene Fund will complement your activities.
So among the services we offer is also fund management. And we have managed funds that include better access to health services. It can be, as I mentioned, in the health and sanitation sector. It can also be in security, rule of law. We see that proper fund management and how you build these mechanisms, they matter to how you engage partners. And that is where I also think UNOPS can play a big role in building attention with and partnerships that can also bring this initiative to scale.
So, of course, those new initiatives will include reaching out to potential investors. How optimistic are you of engaging with them?
I think definitely that the potential is there. And bringing partners along, I think also will help to build better awareness around this, because as I started out by pointing to, water, clean water is at the core. And Also, good sanitation facilities are at the core for development of communities, gender equality, and so many things that also matter to investors. So by building this mechanism right, I think, again, it will attract investors and ensure that we are able to bring a step change to the attention of the SG number 6. So the whole focus is operational. So it's not at the political level, but to be successful at the political level, you need somebody to implement well, and that's where we sit.
The Executive Director of UNOPS. Another voice that's raising its support for the Sanitation and Hygiene Fund is Gilbert Haungbo. He's the chair of UN Water. This coordinates the efforts of UN bodies and international organizations working on water and sanitation issues.
In a world that is experiencing deep social and economic upheaval in the face of COVID-19, the launch of the Sanitation and Hygiene Fund is a hopeful sign. On behalf of the UN Water family, representing 33 UN members and 42 partners, we look forward to the fund's efforts to provide strong and reliable support to countries as they work to expand sanitation services. UN Water agrees with the fund's diagnosis that there is an urgent need to do more. The world is alarmingly off track to achieve SDG 6, which aims to ensure water and sanitation for all. This is why UN Water launched the SDG 6 Global Acceleration Framework. It is designed to galvanize action to reach all 8 of the SDG 6 targets. By focusing on SDG target 6.2, this fund will bring much needed funding for sanitation, hygiene, and menstrual hygiene management. Accelerating financing is fundamental to the Global Acceleration Framework. We know that mobilizing funding will improve service delivery. The UN Water family welcomes the Sanitation and Hygiene Fund and look forward to joining forces through the SDG 6 Global Acceleration Framework.
The chair of UN Water. So I hope you've learned about the important work of this fund. 4 billion people worldwide do not have access to safely managed sanitation services. And unless and until they do, the world cannot meet the goals of inclusive and sustainable development by 2030. We leave you with some voices from around the world about what it's like to live without access to this fundamental right of sanitation and hygiene. From me, goodbye.
There are very many young girls in Uganda whose parents cannot afford the menstrual health hygiene materials. Because of the poverty that is impoverishing Uganda, many young women have to use towels when they have no soap or water. Some have to use old bed sheets and take strips out of them and fold them.
मैं ये कहना चाहता हूँ, जब से इस देश पे कोरोना आया है, तब से हमें बहुत सी समस्याएं हो गई हैं, क्योंकि हम कूड़ा उठाने और भरने का काम करते हैं, जिससे कि हमें कोई सुविधा नहीं, हमें ऐसा डर सा लगता है कि कहीं हमें ना हो जाए, क्योंकि जहाँ हम रहते हैं वहाँ टॉयलेट और पानी की बहुत सी समस्या है। एक टॉयलेट पे 20-20 लोग जाते हैं, जिससे कि मुझे लगता है कि हमें भी बहुत जल्दी हो सकता है, क्योंकि हम बहुत
Ary eo ihany koa ny hoe amin'ny maha-vehivavy ny tenako dia maro ireo vehivavy izay mbola hita fa mitanjaka eny anivon'ireny fiarahamonina ireny amin'ny tsy fananana kabone izay kabone mitokana, dia izany dia tena tsy azonay mihitsy, tena atao hoe tsy rariny mihitsy satria teraka tsy fananana fanajana intsony eo anivon'ny fiarahamonina, tsy manana ny haja intsony zany ny vehivavy eo anivon'ny fiarahamonina.
When I started visiting these slums on a daily basis, I got to know that there is only one toilet facility which is being used by 15 to 20 houses, and it's also being used by both men and women. They are using the sanitary napkins or the cloth strip for more than 7 to 8 hours. And I was quite shocked to know that how can they even use this for more than 5 hours, and they told me they use it for more than 8 hours.
C'est inadmissible de voir un pays développé et on voit que les gens sont en train de pratiquer la défécation à l'air libre. Or, c'est ça même la base. Quand la population n'est pas émancipée, quand les jeunes dames n'ont pas assez aux conditions qui leur permettent de pouvoir poursuivre leurs rêves, pour moi, je ne pense pas qu'on peut vraiment atteindre l'étape du développement comme on le dit.